Welcome and happy Pride Month, everyone. My name is Kevin Morrison, and my pronouns are he, him, his. I'm the Cook County Commissioner representing the 15th District in the northwest suburbs of Cook County. I just want to thank everyone who is joining us live and maybe watching this recording of our discussion. Just a reminder, if anyone has any questions for our incredible panelists, please put those in the comments and we'll be able to get to them as soon as we get to our discussion. I've been hosting virtual discussions like this since April on various important topics. I'm really excited about today's conversation, and today's on creating health equity for members of the LGBTQ+ community, and specifically what could be done for Black, Indigenous, and people of color and members of our community, or BIPOC. As we close out Pride Month, it's important to keep in mind how LGBTQ+ community has fought through thick and thin for decades to be recognized. Our right to be seen within the healthcare space is intrinsically linked to our overall fight for recognition in society. The HIV/AIDS crisis beginning in the 1980s demonstrated that equal access to healthcare did not exist for LGBTQ+ people. That fight continues as major health disparities still exist for LGBTQ+ people. Generally, and even greater disparities exist for Black LGBTQ+ individuals specifically. Part of meeting this important moment in history as we address systemic racism in all parts of our society must be pursuing access to affirming healthcare for Black LGBTQ+ individuals. We've seen very clearly some of these disparities as we face the pandemic. We'll hear more about that from some of our guests today. With that in mind, I have a great group of superheroes, activists, advocates, and all-around incredible human beings joining me today. So let's get to it. I'm honored to first introduce my co-host for today, Toni Preckwinkle, who is the president of the Cook County Board of Commissioners and the Forest Preserves District of Cook County, as well as an incredible advocate for the LGBTQ+ community. Thank you so much, Madam President, for being with us here today. Thank you.
Thank you, Commissioner. I'm Toni Preckwinkle of the Cook County Board of Commissioners, and my pronouns are she, her, and hers. Very grateful for the opportunity to be here. I understand the Commissioner has been doing this since April, and I commend him on his outreach efforts to meet his constituents in as they shelter in place. Let me just say that it's my pleasure to introduce Lasaya Wade, who's founder and executive director of Brave Alliance.
Hello, everyone. Thank you. My name is Lasaya. I'm the executive director and founder of Brave Space Alliance, which is the first LGBT community center on the south side of Chicago, which is fully Black-led, trans-led organization that serves the south side of Chicago.
All right.
Amazing. Thank you so much for being with us today, Lasaya. And it is my honor to introduce Aisha Davis, the Director of Policy at the AIDS Foundation of Chicago. Thank you.
Yes. Good afternoon. I'm happy to be here. I'm looking forward to the conversation. Again, my name is Aisha Davis. I am the Director of Policy at the AIDS Foundation of Chicago. Pronounced as she, her, and hers. And at any point, my cat might make an appearance on camera, but that's what happens when we do this sheltering in place.
Amazing. And thank you so much, Aisha, for being with us today. We also have with us David Ernesto Munar from Howard Brown and also on the Cook County Board of Health. Thank you so much for being with us here today, David.
Thank you, Commissioner. Thank you, Preckwinkle, and my colleagues. Coming home, I work closely with each of you, so I'm excited to take time to think about our equity challenges in the county as part of our Pride celebration.
Amazing. No, it is so incredible to have such a great group of panelists with us today. I just want to give a reminder for everyone who's watching us live. If you have any questions whatsoever, please put those in the comments and we'll be able to get to them. We're going to be beginning our discussion, but I just want to thank our panel for joining in on this incredibly important conversation, especially during Pride Month. But what's important is these disparities don't disappear once Pride Month is over. So it's incredibly important that we continue these conversations and continue working towards equity for all disenfranchised communities. I thank all 4 of you for joining me today, because you are all leaders in helping create the bridge for equity. But my first question for our panelists today is, how is the COVID-19 pandemic impacting the health disparities that already exist? And David, if you would like to begin.
Sorry, I had to unmute there. Sorry. We are seeing that the COVID pandemic is following the disparities, the racial disparities that we see for every other health condition. And you know that,
Please leave a message after the tone.
Sorry. As you know, the pandemic has been adversely affecting brown and black communities, west and south side. The west side has been really adversely affected. And this follows the trend that we're seeing. There's a 20 to 30 year disparity in life expectancy from Loop and Streeterville communities to our west and south side, which is a distance of 5 to 9 miles. And so we're seeing that the COVID pandemic, particularly in terms of rates of infection as well as mortality, has been highest. The Mexican American community on the west side and Little Village has been disproportionately affected, and then south side, west side, black communities as well. And so this is not about biology. This is not about risk. It is not about individual choices. This is about a whole set of inequities based on crowded housing conditions, poor access to health services, working conditions that are unsafe, like food processing and manufacturing, and other ways that the system, really what Black Lives Matter activists are fighting for, that these systemic forces are conspiring to disproportionately affect individuals who are facing other challenges. So we're seeing this play out in a dramatic way with the pandemic. It's not just the police violence that we're facing, but it's really a whole system that is hurting the health of of Black county residents as well as Latinx county residents.
Amazing. Thank you so much for sharing. And Lasaya, I'm going to go to you next. If you could just help, have any of your members been reaching out to Brave Space about how COVID-19 has been affecting health disparities that have already existed?
Yeah, I think it's shown like the already problematic issues of the system that we already have right now, of the lack of healthcare, the lack of jobs, and all of that right now, right? But it also is showing how connected we are. COVID has shown, like, regardless of what you is or what you look like, and gender or race, COVID is here to stay, and Rona is walking out there waiting on you, right? I think it's important that with trans individuals, particularly with a higher risk around getting blood clots, a higher risk around actually their hormones actually killing them a little bit faster than most. So I think it's the understanding the economic state around trans identified folks. In this climate, it hits harder because it's already already disparities in our community that we was already dealing with and trying to solve. Now we're worried about people losing their housing and not being able to even work or even do survival work. So it's a whole levels of different conversations and nuances that we talk about as well.
I really appreciate that. And same question to Aisha. What could you add to the?
Yeah, I think that, like everyone else has said, this is not a new situation for Black and Latinx communities. I also want to just name that for Indigenous communities, this is also a really difficult time. I think I read this morning that the highest mortality rates in the nation are on reservations. And then when you look at Cook County in the state of Illinois, the highest mortality rates are with Black people, and then the highest diagnosis rates are with Latinx people. So what we're talking about is that these three communities are being hit in very different ways. And when we're talking about the systemic oppression that these groups have been facing, we can't use language that makes it seem like it just happened. There was intentional divestment. There's intentional resources that were being held away from these communities. There's intentional actions that took place that caused the distrust in these communities when trying to seek resources, when trying to reach out to elected officials, when trying to maintain these conversations, and modes of communication. So what we're seeing right now is a time where something that is even more deadly, right? Because the health inequities were already deadly for the communities. What we're seeing is a more deadly time. And we're seeing these numbers come in a lot quicker than they did when we were facing what was considered the normal deadly circumstances that these communities had to deal with and work around. So I think that the COVID-19 pandemic, in addition to the uprisings that have happened around systemic oppression, especially anti-Black racism, what we're having is a moment where we can have a conversation about things that a lot of us have already been talking about, but we're able to engage in these conversations in a much more radical way, in a much more forward-thinking way, and in a much more responsive way. I think that one of the things that we've noticed at AFC is that a lot of the hurdles and barriers that existed before this pandemic are being peeled away, right? We're seeing access to telehealth services. We're seeing access to longer prescriptions. We're getting people access to medication for 90 days instead of just 30 days. And what that means is that people who are facing other issues like housing insecurity, you don't have to worry about whether someone can reach you at a specific address, right? You have to worry about if you can make it from point A to point B, as long as you have access to some form of communication that you can use for telehealth services. And what we're trying to do now is to push even beyond what these other concessions have been, and also figuring out ways to institutionalize and really solidify the changes that have been made to make sure people have access to healthcare during the pandemic going forward, so that we aren't returning back to a status quo where Black, Indigenous, and Latinx communities almost expect to get less resources or aren't able to access the things that they need to thrive.
Thank you so much, Aisha. I really appreciate that. And before I pass the mic over to the president to pose the next question for our incredible panel, I just want to give a reminder and thank everyone who's watching this live. If you have any questions for our panelists, for me, for the president, please put them in the live comments and we'll be able to address them. And Madam President, I put the mic on to you.
Sure. Let me just say a few words before I answer the question. What we talk about in Cook County is social determinants of health. And that's everything from, family income to educational levels to access to healthcare to whether you live in a food desert. I mean, all of those things. And as one of the previous speakers pointed out, what's happened in this pandemic is it's laid bare, stripped bare the inequities that we see across communities in the city and in the county. To go back to a point that I think was made by David, that life expectancy in Englewood is 60 years. Streeterville is about 5 miles away, and the life expectancy is 90 years. So we have just incredible disparities in terms of opportunity and life expectancy in communities across the county. And of course, communities that are more impacted by the pandemic that have more social vulnerability. So the infection rate among African Americans is 3 times what it is for whites, and I think the infection rate for the Latinx community is 4 times what it is for whites. So this health equity issue is a real critical one. And so the question for our panelists is, what would you say is the next major priority initiative for health equity? Who was last? I guess Aisha.
Sorry, this is the moment where the cat decides to make her appearance. I think that the next major policy priority initiative really needs to be around the ways that resources can be redistributed, right? I think a lot of the conversations that we have tend to frame the health inequities that we experience as almost pathologizing of communities, right? The life expectancy isn't shorter for Black people just because Black people are less healthy. The rates of infection for COVID-19 for Latinx people isn't because Latinx people are more susceptible to COVID-19. So what we have to do is figure out the ways to make sure that folks have access to the things that they need, the resources that they need, that we're addressing the social determinants of health. And that has to come from from different allocation of resources, and really giving the funding and the resources to the communities, right? Like, we need to make sure that we're in communication with organizations, with individuals, with communities to figure out what it is that they need and what it is that they want, and then let them drive the car, right? We have to give them the keys and let them drive the car. It's not going to work if what we're doing is kind of going based on what has happened before, or kind of upholding the status quo, like I said earlier. So really, the next priority policy initiative should be around redistribution of resources and reallocation of resources to really show that equity isn't about everyone having the same thing. It's about making sure everyone has their needs met. And if that means that the allocation of resources looks extreme or feels extreme, it's because there is extreme inequity to fix in that process. So I don't know. I think the next time that we're talking about budgets, the next time we're talking about where a new hospital is going, the next time we talk about where different grocery store chains can build, we need to make sure that we're directing all of those things to these communities and really doing our part to ensure that they're able to meet their own needs.
Thank you. David?
Yeah, you know, it's a gigantic question. I would start with we need to elect a new president that will support the Affordable Care Act and that will work with leaders for health equity in Congress to offer national solutions. The House of Representatives under Speaker Pelosi passed a Medicare for All bill that is languishing in the Senate. And, you know, applied in Cook County, that could be a game changer. It could help us close the gap on the uninsured. And we've made progress under the Affordable Care Act. And Cook County was one of the jurisdictions with leadership from our president and our board of commissioners to begin Medicaid expansion enrollment early. And thanks to that effort and the legacy of our Cook County Health and Hospital system to serve everyone, regardless of their ability to pay, we've made enormous progress in our jurisdiction, serving the needs of those who are uninsured, who are indigent. But we still have enormous gaps, and the system is still frayed. And unfortunately, our county health system, as our county leaders well know, is absorbing the lion's share of uncompensated care for people who are uninsured, and it's unsustainable. And it really begs a coordinated, cogent system, safety net system, to serve everyone. And I think we have opportunities to do that under the Affordable Care Act, under new leadership, under Medicare for All bill, and with greater support from Springfield to support real assets like county care. That is a Medicaid managed care product. It's a public option that we are offering and utilizing effectively to meet the needs of Medicaid beneficiaries in our county. And it's competing head to head with for-profit entities and doing a much better job at delivering quality. So we have kind of the core tools to put this puzzle together and close those gaps, but it will require a lot of work from everyone, from all of us, from our county board, from our state legislative leaders, and really from our national leaders. And we've not only not had national leadership, we've had the counter of national leadership. You know, the administration has tried to disarm and destroy the Affordable Care Act at every turn through a variety of rules that reduce the quality, the non-discrimination protections, the integrity, kind of the benefit of the Affordable Care Act product. So it's a huge step backwards, and we can't afford another 4 years under this administration.
Thank you.
I think Lasaya is next.
Lasaya, yes.
Thank you. I think David and Aisha said everything I wanted to say. But for me, it's the biggest part around equity is food and education. For me, it has taken away, we've seen how our city has taken away food from the youth in this particular climate, and how that has harmed and has made it the work even harder for us organizations to make sure the youth get the food that they need throughout the city, and how it's imperative that we change the leadership that understands the inequities around education on the South Side, and how most of our youth get their daily or their food during their lunch hour. So we've seen the direct attacks during this particular climate from the city and the state around these particular COVID and health inequities, because the food is the only thing that they have, and also around how we're supposed to keep the youth in schools when they don't have what they need to stay in school. So on the South and West Side, I just want to add that narrative too.
No, I greatly appreciate that. Thank you so very much. And, before I pose the next question, I do want to share a little bit of my own personal story. When I was learning about health throughout high school, we were educated that when it comes to getting STI testing, you're supposed to be tested every 6 months. And I remember as a young adult, my primary care doctor would shame me for asking to be tested. And, I was just following the guidelines I had been provided to get tested every 6 months. And every time I would ask to be tested, he would shame me. And so I had to find another primary care doctor who never made me feel like that. And so I know that still exists today. And that leads me into this question. And I'm going to begin with David, because back in the very beginning, back during the beginning of the HIV/AIDS crisis, Howard Brown and the Core Center with Cook County were two of the very few places LGBTQ plus individuals could receive healthcare treatment in an affirming manner for a very long time. It was for our younger generations who may be watching this, it used to be far worse when it came to seeking health services. And so when it comes to the historical health disparities for LGBTQ plus individuals, especially Black, Indigenous, and people of color, I want David to touch on that, as well as what are some of the barriers that still exist to this day to accessing healthcare services.
Thanks, Commissioner. And I'm sorry you had that experience, and grateful that you were able to select a better medical provider. And, it's a great question. And, places like Howard Brown Health and even the Core Center exist precisely because the predominant systems of care have historically been not only unfriendly, but hostile towards LGBTQ people, shaming, blaming, questioning, and interrogating transgender, gender nonconforming people, blaming individuals that have sexual health needs for their needs, denying, reproductive healthcare services, contraception to individuals who need it. So this is why Howard Brown and the Core Center unfortunately have to exist. Our systems are not providing high quality, culturally competent, affirming healthcare to our community, and that. Even though there's been enormous, in the last 30 years, enormous legal progress, and in some cases cultural progress. I mean, we're seeing more LGBT people on, sitcoms and in the news and in the media. We still, as a community, face enormous barriers in gaining access to health, culturally competent, affirming healthcare services, public accommodations, fair treatment at work, fair treatment in housing. This is still a persistent issue, and again, I'm gonna be that person who just harps on the current administration in the White House. But the White House has actually endorsed, sanctioned discrimination against individuals who are LGBTQ, and made it and sanctioned, at least in the federal context, discrimination against gender minorities and sexual minorities based on personal or religious preferences, which goes completely against the kind of the ethics that a medical provider swears to, as they receive their license. And it's harming, it risks harming the lives of our community for individuals that may not find the kind of medical provider that you found, Commissioner, and who may be mistreated or harmed in a medical setting and may not know where to go and forego care. So this continues to be an active fight. And we also see it in the data. I'll just say, compared to our non-LGBTQ counterparts, LGBTQ people have the highest rates of bullying, highest rates of suicide, attempted suicide, highest rates of depression, highest rates of STIs, cancer, smoking. And so across the board, we see these inequities, and it's not biological. It's actually minority stress, and it's compounded for intersectional LGBTQ people who also face discrimination based on race or gender.
No, I really appreciate that, and that you raise a lot of important aspects of the conversation. And I'll just say, it is just a demonstration of President Preckwinkle's leadership in healthcare equity. I toured a lot of our county healthcare facilities early on when I was sworn in, and upon walking into the Core Center, you cannot walk into that area without seeing LGBTQ affirming material. And, that was just a source of pride for me to see. I've never seen so many LGBTQ specific material, signs, logos, anything at any healthcare facility. So that was great for me. But I want to pass it over to Lasaya. If you could mention, what are some of the disparities that you're hearing in terms of accessing affirming healthcare?
So thank you, David. But also on different levels, even within the LGBT population, trans people face a different type of rhetoric and pushback. I have to really talk about this particular narrative because, especially when we talk about reproductive rights, my partner is pregnant. So we're expecting a child within a month, in a few weeks. And the whole aspect of people not wanting to touch him because of it, even the gasp in certain areas, even we have received them in a Howard Brown setting in certain ways where he didn't feel uncomfortable with certain people. Just because we're LGBT people does not mean that we are literally understanding of the LGBT people, and especially trans bodies. So with him and traveling and going with him on this journey, there has been many pushbacks and many arguments because he did not want to go to a hospital, or he did not want to go to the space because how he was treated and how he was looked at. And also sometimes he doesn't even want to go outside because of it. So it's a whole different level of what does it look like to actually change the narrative and actually change society around that thought process around trans bodies. And I have to bring that clear. And there's a lot of trans people that do not want to go into an LGBT health center because a lot of, especially Black trans people or Black LGBT people on the South and West side, because they feel more comfortable or wanting to go to a Black led health facility, and how important it is to wanting to be in community, and what does that look like? Right now, there's a huge fight that's happening with a lot of health centers on the South Side where they're trying to get money to actually serve the LGBT population, but there's only $2 million in this pot of money for Black-led health centers, and when we're fighting to make sure this is actually more than that, like 17 million. So that goes back into the conversation around equity and what does that look like, and the pushback of why do we have to give you money? Because we said we need more money, and you're not listening to what we're saying that we need, not only just because you're thinking that we don't need it, and then in the education aspect the nuances and intertwining connections of all of this. So I have to bring that particular conversation when we talk about all these things together.
I greatly appreciate that. Thank you so much. And I'm going to now share the question with Aisha. If you could talk about the historical disparities and what you're hearing today.
Yeah, absolutely. So another thing when thinking about the health disparities in this country, we have to really acknowledge the fact that for a very long time, Black folks, Latinx folks, and Indigenous folks were not considered people, right? We were not considered humans. We were not treated as such. So that means that when a lot of the early stages of medical research were happening, we were seen as objects. We were seen as testing objects and not people being treated. And so that narrative hasn't been eradicated from the medical arena at this moment. We're still combating that issue right now. Just thinking about the history of the practice of gynecology in this country, right? A lot of the things that were discovered weren't just discovered. It was based on actual harm, serious trauma and death of Black women who were enslaved. So when we're thinking about what that looks like now, it's not surprising to know that the mortality rate for giving birth amongst Black folks is extremely high. So it adds to the conversation when we think about the historical issues that we're facing and the narratives that came from back then as well. The disparities that we're seeing aren't just because of resources, right? So we're talking a lot about equity right now. A lot of it is also, like LaSaya said, around education and being able to have these conversations and recognizing that in a lot of areas, folks who are trained in the medical profession think that Black people don't feel pain the same way. They think that we don't experience things the same way. A lot of the assumptions and stereotypes and biases against Black folks, especially folks who are read as femme or women, is that we complain a lot. And so if we're complaining, it's just because we're complaining, not because we're actually hurting or in pain or need assistance. And it's something that we can't just pull ourselves up by our bootstraps around, right? Like, this isn't just about economics and where we stand in terms of socioeconomic statuses, right? When we're hearing that people like Serena Williams and Beyonce almost die in childbirth, what does that mean for folks who do not have access to that level of wealth, who do not have access to that level of influence? And I'm not saying that to say that we should all aspire to be billionaires or multimillionaires so that we can access this. What I'm saying is that there should not be a barrier that exists for Black people that is so insurmountable that literally $1 billion of wealth cannot afford you the same level of personhood and respect that every other person is able to receive. So what that means right now for folks is that when we're hearing about these issues, these high mortality rates, these high rates of contracting COVID-19, it's not that anyone in these communities that are being hit really hard are surprised, right? I want us to get to a point where when we're having these conversations around health equity, it's about us getting rid of these narratives and really combating that, and doing so in a way that's not just about us saying, we're seeing this in this pandemic, so let's do this really quickly. It has to be sustained, ongoing work that's done to make sure that all the tools and resources that are needed to combat these historic disparities are there. It means revamping educational systems. It means talking to people. It also means making sure that when we do build those centers and finance those centers in the South and the West Side or in Black and Latinx communities around the state, it's not just us giving money to other people that have been working with these agencies before, right? It can't just be that. It also has to be the new initiatives that are starting up. It has to be the new folks who are popping up and doing this work. And we can't expect to kind of transplant folks from one part of town to another part of town, because that doesn't build trust either, right? We know who's been in the community. We know who's been there listening to us. We know who, when we walk into a doctor's office, is going to look us in the eye, greet us, treat us with respect, use our proper pronouns, not judge us, not ever have an experience like you had, Commissioner, right? We know who to look for when we want to receive those services like that. And like LaSaya said, we just need to make sure that we're giving the money to those folks so that they can do it, and the resources they need to do it. And I also want us to not get too caught up on just the idea of funding too. Like, the funding part is a huge part, but it's also the connections, because we also know that when we hear about these issues, when we have these moments like this in time, there are a lot of names that get thrown up. There are a lot of names that get repeated over and over. And it's not just about making sure that we're funding these organizations, that we're funding these movements. It's also about making sure that those connections that folks kind of rely heavily on when you're having ongoing conversations about granting, when you're having ongoing conversations about sustaining something. We don't want there to be a shiny new thing handed to us and then have folks turn their backs on us once this moment has passed, because that's the way for us to end up back in the same spot again around these discrepancies.
Well, I thank you for sharing that. Wow, I have so many feelings coming in right now, but I do want to just add to that before we get to some of the questions that we've got from some of them folks watching live that, it breaks my heart looking at the vast disparities when it comes to Black women, specifically here in the state of Illinois, when it comes to the maternal mortality rate. It is a stark figure, and it is a clear point in showing the systemic racism that we face as a society, even in the healthcare space. And so I've been beating the drum on the county side about the incredible need for enhanced implicit bias training, but also to make it regular, especially when it comes to the healthcare space, because no patient should be treated differently just based on their ethnicity or how they identify. And so there's a lot of work that needs to be done. I want to thank the president. We just hired an equity director for the county that's goes in line with one of the things that our implicit bias commission was pushing for last year. And right now we do have a couple comments that came in. I want to thank our librarians out there and shout them out. We had one of our local librarians here in the Northwest suburbs just wants all three of your organizations to reach out to your local libraries. They put out information that could help in terms of getting word out about services that are being offered. So thank you to Patricia for putting that out there. That is an incredibly important point. Every town hall, we shout out the incredible Kenneth Young Center here in the Northwest suburbs in 2019. They opened the first LGBTQ plus center in the Northwest suburbs in Schaumburg. And they've been incredible advocates in terms of working with Open Door to get affirming healthcare for LGBTQ plus individuals, as well as STI testing, providing culturally competent services, including rapid HIV testing and programming for LGBTQ plus youth and young adults. They hope that you three will connect with the Kenneth Young Center to help expand their services that they're providing for our community. And then we do have a question from the audience from Krupa, and this is, are there any resources for LGBTQ plus people struggling with substance use? And I'll start with Aisha.
There we go. Okay. I will say that off the top of my head, I don't know of any specific only substance use related work that we're doing. I will say that AFC has a resource hub on our main website where you can go and see what's available right now, especially during this pandemic. I know that we have expanded our services so that folks who are living with or vulnerable to HIV can access them. And I know that substance use is part of all of that work that's being done and under that comprehensive resource guide. So in terms of specifically who you should reach out to or talk to, I'm not 100% sure, but absolutely feel free to reach out to me directly, and I can connect you with the folks at AFC who deal directly with folks who are trying to combat some substance use issues. I know that there is funding that we have definitely looked into that's related to the pandemic around telehealth services as well, because I know that that's part of the resources available for folks who are struggling with substance use. So definitely reach out to AFC directly. Our website was scrolling across the bottom of the screen. And then if you want to just email me directly, my email address is adavis@aidschicago.org. So feel free to reach out to me.
I greatly appreciate that. Thank you so much. And Messiah, I'm curious, what are some of the resources Brave Space is putting out for the community in terms of those who are dealing with substance use issues?
We actually we don't have nothing yet. We are in conversation with that. We actually sent them to Center House and also Chicago House and Howard Brown, because we know our wheel, we know our lane, and we don't want to take a lane that we don't have the access or resources to. So bear with me, everyone. We just found out that someone is actually using Brave Space Venmo, so to steal funds from us. So my attention is going up and down. So if I'm looking down, I'm trying to make sure I put out a fire.
Jeez, good luck. I apologize. But I'm sure we've got hopefully some services over at Howard Brown, David.
We do. Sorry, Losiah, you're dealing with that. That's a great example of what a small CBO leader has to juggle, but you have the best glasses on this Facebook Live. Howard Brown does provide some recovery services. We have a program called Recovering in Pride, and we offer individual therapy, outpatient therapy for individuals that are struggling with substance use. We also have group services, and we also provide medically assisted therapy for individuals that have opioid needs, and that's provided both south and north through our different clinics there. Our providers have been have gone through that training and are certified to provide medically assisted therapy, which is prescribing alternatives to opioids. And then we also partner very closely with a couple of recovery homes that have inpatient services. So Haymarket has LGBT affirming services, as does Gateway Foundation. So both of those are also those are inpatient settings.
I appreciate that, David. Thank you so much. And Madam President, I want to pose a question to you. If there's anything you would like to highlight that the county is doing right now in terms of health equity.
Well, I just want to go back to a point that David made, and that is that in 1983, Cook County Health, in conjunction with Rush University, set up the Core Center. And that was one of the first places in the country where people could go to seek HIV and AIDS treatment, even before there was an identification of HIV. So we have a long-standing commitment in Cook County Health and Hospital System to treating the LGBTQ plus community, and that's something of which I'm very proud.
That is perfect. Thank you. And if you would like to talk about some of the work that's being done right now as it comes to expanding health equity at our healthcare centers, especially as it links with LGBTQ plus community.
Oh, I have to be honest, our focus over the last several months has been trying to deal with the pandemic. And I would say that, the important thing to remember about our healthcare system is for 180 years, we've taken everyone who comes to our door. And that is regardless of your income or your ability to pay or your documentation status or your gender expression. So we have historically, we've had a commitment to inclusion, and that commitment extends, of course, to the LGBTQ plus community.
I greatly appreciate you sharing that. Lasiah, are you still dealing with a fire, or is it okay if I pose a question?
Go to question.
I tell you, I've been dealing with lots of fires over the past few months, but I'm curious for you, especially when it comes to, gays, cisgendered, males like me. How could we be better advocates? How could we listen more? I'm curious, how can elected officials be more affirming in access to healthcare for the transgender and LGBTQ plus greater community?
Making sure you don't use your own narrative. I think it's understanding that most of us move in our own narrative of what we need and not what everyone else needs. It's important to pass the mic these days. It's important to understand if you look at the table and critically think who's all at that table. If you do not see me and someone that mirrors me at that table, then therefore you're not doing the work. And therefore you're not making sure equity is happening in the space. I think that is the biggest point and the biggest push that we actually have to do is, you're trying to do this for the trans population, but I don't see not one trans leader nor trans person at this table. On also a trans person that has the language to push for trans people. I think that is important. Most cisgender or cishet folks use a particular type of trans person around a palatability that is for their survival and not for everyone's in the community to thrive. And also using this particular trans person to push a narrative for yourself and not for the community itself. And I'm always there to be watching and also calling it out. So if I see it, you will be getting an email.
Well, I appreciate it, and you'll be happy to know that we had transgender and gender non-conforming individuals at the table when it came to our Implicit Bias Commission, and so we tried to have everything from representatives from the community dealing with disabilities, the entire spectrum at that table to help bring about our county recommendations. And so please call us out. I'm open to learn, and I'm learning every day. And it's only a failure when you think you know it all and you stop learning. But I want to throw the same question over to Aisha. Thank you.
Sure. I think that in addition to what Lasai is saying about making sure you have the right folks at the table and in the conversation, I also think it's extremely important for us to remember that a lot of the work that goes into creating the space or setting the table also needs to have these voices around, right? Like, don't just bring a finished product to folks. Actually make sure that you are invested enough in what their needs are. Because it's one thing for us to say we want to serve people living with HIV or vulnerable to HIV, but it's another thing for us to work in community with folks. And that's something that AFC is very proud of doing, is having ongoing communication and representation, both of community members and making sure that we are using our platform to amplify the things that our community members are telling us. Especially during this pandemic, we have been in as many Zoom meetings as you can imagine to make sure that we're all talking, right? I know that I've been on a number of panels with Lasaya already where we're talking about this publicly. But even when we're talking about like the back office conversations that we're having to have, right? When we're shooting these emails around and trying to figure out like what the next COVID-19 responsive package looks like, what it means to have the county president's first veto be to help protect the private health information of people, right? Like we were very happy to see that happen. But it involves this ongoing work to make sure that we're not only being responsive to the things that we know about, but that we're maintaining conversation so that we're not a victim to these blind spots that happen, right? We have had so many people who are receiving services with us tell us about how even with the barriers that are being pulled back, even with the red tape that's being taken off, it's still so difficult sometimes to get access to the resources that are there supposedly to help this community directly, right? If we're still having a situation where we're required to meet in person with folks to get them to sign a form, or if the only way for them to not have to meet in person to sign it is if they have access to a certain level of technology, it's not accessible. And I think that a lot of times when we end up having these rooms where we think we have everyone represented, like Lasai said, we think we've checked all the boxes and we've like filled in all of those different columns that we need to fill in. We still haven't, because if you had the right people at the table, you wouldn't have even thought that just giving access to people with certain types of technology is enough. You would know that by saying that you need to make sure that someone is going out and meeting with someone directly, that it will cause an extreme amount of stress for people who are worried about contracting a virus that there's no vaccine for, and then having to deal with all the other complications, especially if you're someone who is dealing with all of these different multiple axes of oppression, right? When we're talking about folks who are dealing with this multiple jeopardy where they're facing discrimination and oppression based on their sex, their gender, their race, their gender identity, their sexual orientation, all of these things, on top of that is a pandemic. And then on top of that are these current conversations around systemic oppression, right? So making sure that we're in these constant communication and conversation with our folks, making sure that we're in constant communication and conversation with our like allied organizations, making sure that we're in communication with elected officials. I think that that's the thing that will make us more successful when trying to get this goal of equity achieved. So all the elected officials, just stay in touch with us. Know that we're here to make sure that we're acting as a conduit between community and you. And know that your constituency relies on not only us listening to them, but you listening to us and listening to them in the process.
100%. No, I appreciate that. But before I let David answer the question, I was wondering, Madam President, would you be interested in elaborating a little bit on your historic veto and the work that you did to help protect the privacy of health records of individuals here in the county?
Thank you. Well, this was a difficult issue. What came before the board was a proposal that first responders, that is our firefighters and police officers, have access to the addresses of people who tested positive for COVID-19. And as I talked to commissioners prior to the vote, one of the things I said was, this is not good public policy. It's not something we did during the AIDS crisis, which is, continues, but it's not something we do in terms of people who have tuberculosis or have, sexually transmitted diseases, or, this is not good public policy. And I would just say that a number of our commissioners were lobbied very hard by the first responders who felt that this information would somehow protect them from the pandemic. But of course, we know that this is a disease that's very infectious and lots of people are asymptomatic. So the idea that you could assume just because an address isn't on a list that the people at that address don't have COVID-19 is not true. So it really provided no protection for our first responders. What I said is you have to assume that any household you go into is potentially one where COVID-19 is present. And we should not violate the privacy of those individuals who have succumbed to the infection by providing anyone with their addresses. We never know how this information will be used once it's out there. And we know that public health information can be used to discriminate against people. And we don't want to be in the business of doing that. So yes, for the first time, thank you, Commissioner, for the first time in the 10 years that I've held this job, I vetoed an action taken by the Board of Commissioners.
Well, I thank you so much for your leadership, especially on that issue. I actually had a conversation with one of the commissioners who had voted to release that information, and this was a few days later, and it was the day after George Floyd was murdered on the streets. And that individual actually told me that had this occurred prior to that, their thinking and what they would have advocated for would have been completely different. And they recognize some of the intrinsic and systemic racism that does affect decisions like that. And Madam President, I think we have time to pose one more question. If you would like to pose the last question for our panelists.
All right, I guess I should ask, how can elected officials be more affirming in access to health?
Next question.
Next, I missed one, okay. What are some of the barriers that exist to accessing healthcare services? There we go. Did I do right now, Commissioner?
Yeah, no, that works. And yes, no, that would be perfect. And who would be like, Lasaya, would you like to go first?
Ask me that question one more time. Oh, ask me that question.
Barriers. I'm sorry. What are some of the barriers that exist to accessing healthcare services?
Some of the barriers.
Or, well, I know we kind of talked on barriers too a little bit. Or what is your biggest takeaway?
Commissioner, what question would you like me to ask?
The next one, number 8.
Good. Thank you for the prompt. What do you think is the biggest takeaway for people listening to this? Okay.
I think the biggest takeaway is to educate yourself. For me, I'm big on education. If y'all have not heard, I think for me, in my particular narrative, again, is pushing education, the lack thereof education, because Malcolm X said the best: if you want to hide something from someone, put it in a book. And what does that look like? We've been told not to read. This is not going to do nothing. This is not going to be beneficial for you. But you have 3 educated people on this line. As an educated woman, I have to make sure. It took me a long time to get my education, and it's taken me a longer time for people to see my education because of my narrative and respect my narrative. And the person and what I bring to the table. I think that is the biggest thing for me, is respecting someone's education, also respecting what they can bring to the table. Because most of the times I always treat it like, oh, Lasaya is in the room. And also, oh, do you need it? No, I'm a grown woman. Respect it. I'm a grown woman with an MBA, and respect that as well. And when I can come into space and respect what I can bring into the space. So I want people to take that away from this.
Thank you. Let's try David next.
Well, I mean, I think for me, some big take home messages. One is cultural humility. Is, we don't, we're individuals, we're people. We know our experience. We don't know the whole vastness of human experience, but we can be humble to receiving the input, the feedback, the wisdom of people that have different experiences. It's also just empathy. Empathy is under valued, I think, in our society, and that's being able to say, I don't walk in your shoes, and I can't but I'm hearing what you're telling me about what that's like, and I can respond from a human experience. You know, I think so many times there are real unique needs, healthcare needs, or justice needs for the LGBT community, but they are not they're not rocket science. You know, I mean, I was touched by Lasaya's message that, you know, what's most important in her community is education and food. Like, we can all relate to the power of education and food security, you know. So I think those are really important. And lastly, allyship. I really want to echo the thanks to President Preckwinkle. I mean, I had lots of conversations with our commissioner about the proposed ordinance. I was in a lather about, you know, an ordinance that would perpetuate stigma for people living with or who were diagnosed with COVID, and seeing, you know, kind of the errors of HIV repeating themselves. And I was thrilled to know that our county president needed no persuasion around that being a bad idea. And so thank you. And so I think it was a great example of just allyship. I mean, you really knew the lessons that we had learned the hard way in HIV and didn't repeat them.
Thank you. Aisha, conclude for us?
Sure. I think that the biggest takeaway that I would hope that people have in this conversation is that there are so many people who are experts in so many things. But like David said, we're all experts in our own experience, right? And in this moment, what we're hearing about is the experiences of other people. We're hearing about, on a huge scale, a global scale, these conversations, not only around anti-Black racism and oppression, but also around this COVID-19 pandemic and the ways that healthcare systems are either unable to or are adapting their ways of being responsive to that, right? So my biggest takeaway that I would want folks to have in this moment is to remember that what we're living through might be unprecedented, but we have so many people who have been training and educating themselves, like Lasaya said, and preparing for this moment. And if I had to have a one sentence message to leave people with, I would say, let this moment catalyze you, let it radicalize you, and let it make you become part of a movement towards equity. And that equity is going to look like liberation for a lot of people. That equity is going to look like the ability to meet your own needs for a lot of people. But yes, the one sentence thing is, let this moment be your entry point to this movement for equity for all people.
Thank you. And thank you very much, Commissioner, for allowing me to be part of your town hall, your virtual town hall.
Of course. No, I just want to thank all of our panelists and you, Madam President, for joining in on this conversation, from Brave Space Alliance, Howard Brown Health, to the AIDS Foundation of Chicago. Thank you for your leadership in helping STEM equity in the healthcare space, especially as it pertains to LGBTQ plus individuals here in our community. It's incredibly important. Madam President, I do want to pass the mic over for you for any last words before we conclude.
No, I just want to thank you, as I said, Commissioner, for your help and support, your hard work in reaching out to your constituents, and your opposition to the effort to provide to the first responders the addresses of COVID-19 patients.
Well, I greatly appreciate your leadership as well. And just a reminder for everyone, the science is clear now. Wearing a mask is a layer of protection for you and your health and the health of those around you. And so, of course, there are so many. I wish this could go on for 2 hours, because I feel like this conversation's not done. And we will definitely be all joining together to continue this as we advocate for that better and more equitable future. I want to thank everyone who watched this live. For those of you who watched this recording, if you have a question for me or any of our panelists, put them in the comments, send me a private message, and we'll be happy to get those questions addressed. And then I look forward to next week. Next week, we have Cook County's new equity director joining us with some local leaders here in the Northwest suburbs for a conversation on greater equity for all. And so I want to thank you all for joining me, and I hope everyone stays safe and healthy out there.
Thank you.
Thank you.
Thank you.